Welcome, welcome, beautiful people of Stanislaus and San Joaquin County to our third session of collaborative planning and implementation. You can go to the next slide. So as a reminder, recording is in progress, so smile at the camera. Okay. You all should be used to the drill by now, but if you can go ahead and update your Zoom name to include your name and the name of your organization, that'll help us know who is on the call today. One of the norms that we created together our first session is that we want to have fun. And in a world where we are all working hard to give people the support and resources that they need, it's important that we have fun and we stay refreshed. So get your chat ready. And what fictional world or place would you like to visit? What fictional world or place would you like to visit? Go ahead and put that in the chat for us. Hogwarts, good one. Shiva likes wizardry, Stars Hollow. Avatar world, yes. For me, it's anywhere I could fly. I really want to fly. Let's get a couple more in here. What fictional world or place would you like to visit? No preference, just a break would be nice. Anywhere I can sleep on a cloud. Yes, I agree. Clouds are fantastic. Wonderful. All right. Well, we are already doing it, but please continue to engage in the chat. Of course, use your raise hand function. You're also welcome to come off mute and hop in. We're all a community here. And I am going to ask people to read some of the things that are on the slides so that we are hearing each other's voices and coming into the space together. So if you have a preference for me not to call on you, go ahead and chat me for that. All right, let's go to the next slide. Welcome again. Ooh, Radiator City, Hector, yes. Radiator City from Cars? Is that what that's from? Is the Cars movie? I think it is. That's great. Okay, maybe I can ask Natasha to read these group norms for us that we established in our first meeting together.
Yes, you may ask. Can I decline? No, I'm just kidding.
Yes.
Okay, let's see. So we have agreed to prioritize safety to ask questions, clear and easy to understand information, room for fun while learning new information, mutual understanding to give one another the benefit of the doubt, willingness to share our experiences with the group. The more we share, the better we become. Openness, let's not avoid conversations. Learning, not judging. Space to connect. Support, safe and honest about the differing interest of participants. Mutual trust and collaborating. So let's update our Zoom names.
Thank you, Natasha. I appreciate you.
You're welcome.
Any questions or clarifications about any of these norms? Okay. I invite you all to just take a moment and think if there's one in particular that you'd really like to practice or try on today. We all have very busy lives and we are back to back in meetings. So any moment that we have to take a deep breath and be present, I want to invite that in. And for me, a norm that I want to practice today is clear and easy to understand information, really breaking it down into digestible pieces. Next slide. Okay, assumptions about who is here today. That you represent a California-based organization in either San Joaquin and/or Stanislaus counties, that you are interested in or you're currently providing CalAIM services related to enhanced care management or community supports, that you have registered. We appreciate you for registering. It's a really important thing so that we can really keep track of everyone who's in the room. And most importantly, that you are committed to improving the lives of Medi-Cal beneficiaries and collaborating with each other to really achieve the goals of CalAIM and continue to improve the experience of all Californians. Next slide. So here's what success looks like at the end of today's agenda, is that we have reviewed and reacted to the revised AIM statements that are intended to guide our work together. Our AIM statements, they're really our goal statements. What is it that we're all in this room together to do? The second one, that we discover and affirm the drivers that will inform our work planning. So the drivers are the indicators. How do we know that we're on the right track? In some sense, it's a roadmap or a work plan. And the third is we want to inform the measures that we'll use to track our practice, our practice and our progress, excuse me, so that we're really clear on metrics together. Next slide. So today's agenda, you all should be used to this by now, but we're going to break it up into 3 parts. The first part is about recapping what we have agreed to in previous sessions, like the norms, and to share back what we've heard from all of you in the last sessions together. The second part is we're going to be doing action planning together. We'll have a little bit of time in the large group together, and then some good breakout time to really get in the work together. And then last, we will wrap up with next steps. Next slide. I am now going to pass it to the incredible, the amazing Alexis Taylor with Health Begins, who's going to really summarize what we've heard in previous sessions together. Over to you, Alexis.
Thank you so much, Ashlyn. So I'm going to let my husband know that he cannot introduce me unless he says it exactly like that. He has to say the amazing, fantabulous, all of the above. I take it with so much love and appreciation. Thank you, Ashlyn, so much for getting us set up for the next part of our conversation. It's incredibly important for us to make sure that we're doing these session recaps because, number one, these sessions have been so rich. So much conversation has taken place. So many themes have been unveiled, and we have new participants that might be joining us. So just to make sure that we're level setting amongst one another to remember, hey, like what happened a month ago? And number two, to make sure that any new participants can have like just a real fair and easy understanding of what we did. We just want to make sure that we level set together. So if we go to the next slide, during the last session, we discussed what stakeholders want to achieve by the end of this collaboration. Just as Ashlyn uplifted, you've let us know, like, hey, there are a number of challenges pertaining to CalAIM. How do we rectify this, and what does that look like, by the time we've reached the end of this year together? We also discussed the development of an AIM statement or AIM statements. Those are going to be the statements that, based off of your feedback, we've collectively designed to say, hey, this is our North Star. This is what we want to achieve. Number three, we also discussed during the last session, what we need in order to accomplish that aim. Like, this is what we want to do, but how are we going to get there? What does that change look like at a practical level? How do we measure that change? So those are some of the topics that we discussed. And then lastly, we discussed the timeline, outlining that during this first quarter, January, February, March, we're really trying to unveil those issues and those challenges and those themes. So that way, during quarters 2, 3, and 4 of this year, we can develop a work plan to really start working towards the mediation of those challenges. So just a quick recap, during the last session, we discussed what you want to achieve, what those AIM statements, those goals of ours could look like by the end of this year, how we'll measure that change, and what timeline we're working on in order to accomplish this work together. And so if we go to the next slide, we will see that during the last session, we hosted 2 conversations that were purely amazing. And so we separated into 2 work groups. The first work group was a group that was already implementing and or working with other CalAIM stakeholders that are implementing community supports and enhanced care management services. And the themes that were presented in that group, in that implementation work group, were very revealing. So I want to just really highlight the 4 most prevalent issues that came up based off of what you shared. So number 1, we have this need to really improve and streamline processes surrounding referrals, billing, and authorizations. And so a couple of participants in this collaborative deemed or coined this triple threat, this triple issue, the triple redundancy, and specifically stated that sustainability amongst CalAIM stakeholders cannot be met unless all 3 of those are addressed. So this sustainability measure that's so important, with regards to improving issues around referrals, billing, and authorizations. Another major issue that was arose was rate viability. Specifically, you all stated, some providers will not reach sustainability through referrals capacity alone because the rates are currently at a deficit. So rate viability was something that was very important for the implementation group. Next, there is this call to improve care coordination and data sharing. Specifically, it says, if we saw success in 5 years, people would be able to walk through the right door, lay out their problems, and providers would have a coordinated way to find them in the system without having to re-traumatize them. That really landed such a powerful statement. And so the goal of the participants was to improve care coordination and data sharing to make sure that Medi-Cal beneficiaries are being supported in the best way possible. And then lastly, relationship building. It says we can improve coordination by improving our relationship. What specific relationships? Those between HIEs, community-based organizations, managed care plans, community leaders, community members, et cetera. And so making sure that at the core of this work, we're prioritizing relationship building. So that is what you told us during that second session, specifically from that implementation work group. If we go to the next slide, we had another work group that was uncontracted. These are organizations that are working to understand CalAIM, working to understand the contracting process and outlining issues that they've experienced or needs that they're identifying pertaining to those specific stakeholders. The 4 core areas that we were able to pull out of that pertain to having a deliberate equity lens. What does that mean to have a deliberate equity lens? It states we should be explicit about uplifting emerging organizations from communities of color that have been harmed by policies. So making sure that we're being intentional about pulling organizations that serve BIPOC communities into CalAIM, making sure they're a part of this process. Number 2, this group uplifted capacity building, specifically stating that lesser capacity CBOs need upfront funding in order to pave a pathway to participating in CalAIM. Another theme that arose was related to workforce development. You all told us we need workforce training like coaches that work regionally and help providers get into the system and manage and support performance and processes, i.e. reports and billing, but also providing staff training not just on processes, but making sure that they are trauma-informed and culturally competent. Lastly, the language that I'm going to use right now was not the language that was used in the session. However, we were able to pull this out of what the ask was. Participants uplifted a very strong need for community education, trying to get an understanding of where beneficiaries can go to learn about CalAIM services. Where do they find out, where community supports providers are, where ECM providers are, where do they learn more about these new benefits? So there was a strong need for community education. And also, where is the blueprint for providers to subcontract if they don't have the capacity to directly contract with a managed care plan? And so collectively, as we investigated these issues, we're realizing there is this ask for a community hub. Where is that one centralized location that beneficiaries can go? And the second part of that, where are the financial hubs? Where are those contracted entities, for example, a county agency that a smaller, lesser resource CBO can go to contract? And so, like I said, at the top of this section, we really just wanted to reiterate back to you everything that was shared with us during that last session and since that last session for the purposes of developing joint statements that we will work to achieve over the course of the next year. And if we go to the next slide, I'm going to share with you what we were able to develop based off of the needs that were uplifted. We're not going to discuss these AIM statements just yet during this section, but I at least wanted to make sure that we were presenting them to give you a preview. I know we sent it out via email, but just to give you a preview before we dive into the work planning component today, in which we will break these AIM statements down, tear them apart, rip them apart, put them back together, just to make sure that it is completely in alignment with our collective needs. And so that first AIM statement, going back to the triple redundancy, rate viability, the call for improved care coordination, and the call for more relationship building. The AIM statement that we designed based off of that feedback is the implementation work group will advance sustainability in CalAIM by reporting improvements and the processing of claims by streamlining the referrals and authorizations process, what the collaborative coined as the triple redundancy by December 2023. And built within this AIM statement are multiple components that we would work plan over the course of the next year to make sure that those participants in that work group would have their specific issues or the needs that they have met, right? And so that's the first one. And so I just wanted to share that back, repeat what was information that was lent to us and break down, what that AIM statement is. And like I said, in the next section, we'll be able to have a very exhaustive conversation surrounding that AIM statement to make sure that it's meeting the need, meeting the call of this collaborative. And if we go to the next slide, I wanted to now review the second AIM statement for that uncontracted group, for those organizations that are working to participate inside of CalAIM or as a part of CalAIM. So that AIM statement is that the contracting work group will work to build the capacity of diverse stakeholders to successfully participate in CalAIM by identifying the contracting barriers pertaining to funding, certification, and pre-implementation in order to increase the number of eligible ECM and CS providers that have secured CalAIM contracts. So once again, that second AIM statement is really focusing on those uncontracted entities that are working to participate in CalAIM. And then if I go to the next slide, I just wanted to very briefly do a recap of how we got to this and where we're going next. And so if we go to the timeline on the very next slide, there we go. As I mentioned at the top, January, February, and March have really been about identifying those issue areas, assessing gaps, listening to your feedback, receiving your feedback in order to make sure that we are designing AIM statements that you want to achieve by the end of this year. During April through June, July through September, October through December, we are going to execute the work plan that's going to lead us to meeting those AIM statements, lead us to successfully achieving that goal that we have together. All of that being said, there's a lot to unpack there, and we have a lot of time together today, about an hour that we'll spend in our breakout rooms, just really discussing, what I just shared, refining based on your feedback and making sure that we're unveiling those ideas that you have to be able to meet this goal together. All of that being said, it's time for some action planning. And so I will pass it back over to Ashlyn.
Thank you. Excellent, excellent summary. I really appreciate that, Alexis. So what we'll finalize today is the AIM statement, which names what we're trying to accomplish, our big goal together. The driver diagrams, which again, is defining the change that we need. What are the drivers that will really dictate our objectives that we're going to cover each quarter? And our measurement strategy. How will we measure progress and ensure that we are meeting our goals? Next slide. All right. So I'm going to ask for a couple of volunteers. Maybe I can ask John and Nye if they're willing to read these AIM statements. John, would you be willing to read the first one? And Nye, would you be willing to read the second one?
Sure. AIM number 1, the implementation work group will advance sustainability in CalAIM by reporting a % improvement in the processing of claims by streamlining the referral and authorization process, triple redundancy, by December 2023.
Thank you, John. I appreciate you. Nye, are you willing to read the second one? Okay, how about Tammy?
Yes, I can read the second one for you. Hi. AIM number 2, the contracting work group will work to build the capacity of diverse stakeholders to successfully participate in CalAIM by identifying contracting barriers pertaining to funding, certification, and pre-implementation in order to increase the number of eligible or uncontracted ECM and CS providers that have secured CalAIM contracts by X% and support at least X% of remaining eligible providers to move forward in the contracting process. I think there's an extra 2 in there.
Okay, thank you so much. Next slide. So now we want to hear your feedback on each of the AIM statements. We're going to ask you to complete the poll. So poll number 1, for contracted participants and stakeholders working with contracted organizations, which is AIM statement number 1. How do you believe it aligns with the goals of your team participating in this collaborative? You strongly agree, neutral, disagree, or strongly disagree? And as soon as we have a majority of responses, we'll look at the results. And I'm going to also ask people to come off mute and share why you answered the way that you did. These AIM statements are really, okay, Jim, thank you. Good luck with the window. These AIM statements are really for us to drive our work together. Want to make sure that they're landing where they need to. So if that poll is up on your screen, go ahead and answer it. Great. So 13% strongly agree, majority agrees with 63%, and 25% are neutral. So if you're someone that strongly agrees, would you be willing to come off mute and tell us why? And again, no answer is good or bad. This is really for the spirit of feedback and co-creation of the group.
This is Tammy. I'll speak up. I put strongly agree because I feel like the system coordination is always challenging, but especially so when you're implementing something new. And it's so important for things to be streamlined, not only for the clients or the patients themselves, but for all of the staff that are involved, because we end up duplicating things so many times. There's just the productivity that we could improve by having that streamline is really important, and also reduces burnout. So I think it supports everyone, the patients and the staff of everyone who's involved.
Thank you, Tammy. I really appreciate that. Yeah, the systems element. How about somebody who answered neutral? Case or Casey?
I actually didn't answer neutral. I answered agree, not neutral. But I can tell you what I was thinking. I want to hear from you.
Yeah.
Okay. I don't know if I'm reading it right or not reading it right. I liked everything Tammy said about why she said strongly agree. My only question is this intended to be kind of a bidirectional processing of claims that is only between the payer source and the healthcare provider, or will it also help the cross coordination and collaboration of referrals and authorizations between different care partners? I guess that was sort of a question, but that was the only reason why I didn't hit strongly agree, is because it just looked like it was two ways, not crossways.
And so I can definitely jump in to say that it would definitely include that crossway coordination that you're uplifting. And that was incredibly important for us to process, because as a part of our breakout room discussions, we're going to break down exactly what is going to drive that change for us. And so that peer-to-peer coordination that is being uplifted right now is something that we did capture from the last session. And so that is listed in that driver. And so really excited to hear that. I know that it would have been a lot to process had we reviewed the drivers first, but just flagging that, we'll absolutely get to that part of the conversation as well.
Thank you. Then I would change my vote.
Thank you. This is why the feedback is so important. John, I see your hand up.
I just kind of had a comment about claims in general. I think one of the problems with claims is we're working with one managed care plan where the claims are based off of encounters. And then we're working with another managed care plan where you only get your per member per month rate if you engage with the member for 2 hours a month. Those are two very, very different ways to manage the program. And those are the things that we need streamlined. It's really hard to account for those differences while maintaining the same type of quality of care and overall same deliverables and things like that. I just want to add that.
Yeah, I really appreciate that. That's the kind of feedback that's so critical in this process. So we really understand what are barriers, what are difficulties. So we're making progress. Thank you, John.
Yeah, and I want to add on top of that as well, John, thank you so much. Because once again, going back to that driver diagram, that was also something that we listened to as one of those change ideas from the participants, is having some type of uniformity, within, within that process. And so that's also something that was flagged. So once again, just super excited to hear that what we chronicled is being re-uplifted right now. So just super appreciative of that. And Ashlyn, I also wanted to ask, I'm not sure if this is a good time. You can let me know the best moment for this, but do we also want to concurrently open that Jamboard to document some of that feedback as well? Because I know this is just gold. I know we're capturing on the back end, but this is gold. But anytime is totally fine. I just thought it was really exciting to hear this feedback.
Absolutely. Yeah, that would be great. We can share screen with the Jamboard information that we're inputting. Is there somebody that responded neutral who's willing to share?
This is Natasha. I'm willing to share. So I selected neutral because similar to what John was saying, we have one health plan that is taking in encounters. They're, the authorizations are pretty straightforward and simple, and we can do what we need to do. And then there's another one where we're running into quite a few challenges. And my concern, I guess, I want to be very positive and say we're really going to be able to help make change. But then there's a part of me, I guess, that has just been kind of going through this for a long time, now, and I'm feeling a little discouraged at our ability to get some of this streamlined and more flexible and really make things easier for the providers who are out there providing this service versus just increasing the administrative burden and barriers. So I think that's where I'm at. And maybe it's just the space I'm in today. Maybe if this question was asked tomorrow, it would be a little different. But I very much agree with what Casey has said, and Tammy and John and everybody else. I'm just not sure, because the same conversation came up in a CHIAC call on Friday, right along these very same lines. And so it's clearly a challenge that many are facing. I'm not sure.
Yep. I hear you. The work is hard and it's a marathon. So I hear you. I hear you. All right. I think we are ready to go to our second poll. Huge thanks to Shiva, who behind the scenes is making all the different screen sharing and polls happen.
Just to jump in real quick, could we repeat some of that feedback just so we can make sure that it gets recorded?
Mm-hmm.
Thank you.
Yeah, absolutely. So do you want to summarize it, Alexis?
Yeah, absolutely. So on the back end, I've captured from Tammy that this information resonates because systems coordination has been very challenging. There's so much duplication that, it can cause burnout. For Casey, claims have also been very challenging. From John, some claims are encounter-based while others are not. So once again, making sure with Casey and John that within this AIM statement that we're making sure that some specificity regarding those improvements around claims and billing are identified. And then from Natasha, my friend over here, I'm so sorry that you are feeling discouraged. And like you said, it could be where you are today in this space, but I really hope that, just going back to those norms that we've established, that this is a space where we want you to be able to share that with us, right? Because it lets us know how deeply, some of the challenges have been on behalf of the providers themselves, on behalf of participants. And so we want to make sure that those claims processes, once again, going back to what Casey, John, and Natasha have reflected, that there's some specificity regarding how we embed that into the driver diagrams and the change ideas that you all have in order to make sure that those outcomes that we're striving for are actually being attained. And so Natasha, also going back to what you were saying, that's why it's super important for us to have this measurement strategy. We don't want to just talk the talk. Being able to identify these goals and then track progress is going to be a major part of the work that we do together over the next few months as well. So just hearing everything, validating everything, and I'm super appreciative that what you're saying now is very reflective of the notes that we took over the past couple of sessions.
Wonderful. Thank you. All right, we all ready for another poll? Another poll, fired up, ready to go? All right. So the next poll is going to be asking about the second AIM statement. So again, to reiterate, the contracting work group will work to build the capacity of diverse stakeholders to successfully participate in CalAIM by identifying contracting barriers pertaining to funding, certification, and pre-implementation in order to increase the number of eligible, currently uncontracted ECM and CS providers that have secured CalAIM contracts by a certain percentage and support at least a certain percentage of remaining eligible but uncontracted providers to move forward in the contracting process, because we know there's different phases of the process. Okay. So for this AIM statement, you strongly agree, you're neutral, you disagree, or you strongly disagree that this aligns with the goals of your individual team participating in this collaborative.
So I don't know, again, I don't know if my coffee has just finally worn off, but for some reason I'm having a bit of trouble wrapping my head around this question. So when we say for uncontracted participants, we're talking about those who want to become providers or communities, like community support providers or ECM providers. Is that correct?
Yes.
Okay, great. Okay, never mind. Maybe I'm
coffee is on.
And I just want to call out as well, going back to what Ashlyn stated at the top of the call, Natasha, that making sure that we have that clear and easy to understand is a priority. So if there's language tweaking that needs to occur, especially for those that resonate with this AIM statement, we know that there are some distinct groups that are in the room right now. Let us know, because even though there's a lot that's built in based off of the feedback that we heard, we don't want it to feel jargony. So let us know, like, hey, like what needs to be changed, scrap this, add that, so on and so forth when we get into those breakout rooms, to make sure that we are on par with, you know, what the ask is.
Exactly. Great. Okay, so for this one, we had 8% strongly agree, 67% agree, and 25% were neutral. So let's hear from someone we haven't heard from yet and somebody who agreed. And we can switch to the Jamboard so people can see responses. Thank you.
So this is Kevin Hamilton from Central California Asthma Collaborative.
Thank you, Kevin.
And I chose neutral. I think there's a lot of questions still. Number one, we do a lot of mentoring with community-based organizations up and down the valley, and of course, are working and contracted to do CalAIM asthma remediation AR there in these two counties, and engaging other partners. The problem is having the time and, more importantly, the money to be able to assist others. So we'd love to do it. And then the second piece is, quite honestly, the major barrier, and I mean no offense at all, toward health plans in this, but I mean the plans are kind of their own worst enemy in this situation. I think they're trying as hard as they can. They have a lot of standards they have to meet too. They just can't willy-nilly, start signing people up and say, here, go see in my members. So I think we've got a long way to go. And I know the state is providing some TA for some of this, but quite honestly, the TA is more focused at which sort of CS you're going to do, or ECM. But I've always said there needs to be TA provided on how to work with health plans, how to develop contracts, how to assess your own organization's needs so that whatever contract you create is sustainable. I mean, you wouldn't want to contract and then find that you didn't really have a good idea of the cost of operating your organization, to do something like this, for instance. So, and that goes again back to capacity building. So the plans want to build capacity to have enough people to do this in their community, make sure the members get access to this benefit. But I think the folks who can do it need some help building that internal capacity. So, and that's why I'm kind of neutral on it at this point.
Yeah, really, really helpful feedback. I'm also seeing feedback in the chat that this could be simplified and captured in the measures. So taking a note of that as the facilitator of small group 2, that we can simplify that. I'm seeing a hand clap from John over that. So Deborah, let's hear from you. I think your hand was up first, and then we'll go to John.
Hi, so this is my first group joining, so if I say something off base, let me know. But when I was reading this, I was like, why am I not agreeing right away? And I came up with 2 areas. One that was just previously mentioned was sustainability. We're not talking about sustainability, and really, I agree. I think it's a challenge for organizations to do the fiscal analysis of especially with the varied payments and how they're paid depending on the health plan. And so sustainability is huge. And then the other area that caught me is when we were talking about the contracts, it doesn't talk about being strategic with not every ECM or CS contract might be created equal. If you have every contract focused on a specific priority population, we need to be more strategic in leveraging contracts that hit the different populations. So I think it needs to be a little bit more strategic than just a percentage, because that could be very misleading if you're not representing the populations correctly.
And so,
really
yeah, thank you so much, Ashlyn. Deborah, thank you so much for that feedback. Really appreciate it. Going back to what Kevin uplifted, I want to call out that this is also some of that feedback that you're presenting right now about the providers themselves not having the capacity to provide that fiscal analysis. Spot on. That is exactly what we have been hearing about this financial capacity, let alone having the capacity to navigate that contracting process. And so going back to this conversation about the drivers, like those change ideas that are needed in order to make this a reality, this is exactly like what needs to be uplifted. So I just can't thank you enough for just calling that out. And I know that, I can't remember, Kevin, if it was you during the first session, but something that was also uplifted, which is, identified in our norms, is that having this awareness that there are some competing interests, right? And trying to figure out a way to make sure that we are advancing the work, like with this measure of solidarity, and also being realistic about those competing interests, right? And so I just wanted to flag that I really appreciate that feedback. And it makes me wish as though right now in this moment, we may have changed up some of those slides to be able to present those drivers at the same time with those statements. So that way we could capture that. But I know we're going to have that part of the conversation. And Deborah, going back to what you're saying as well, the sustainability measure. I know that that's something that has been discussed. So as a part of that first AIM statement, that rate viability, that came up a lot during the past couple of sessions. So although you just joined today, welcome, thank you. It lands, it resonates deeply. And then also pertaining to not all contracts being created equal, I would really like to take a deep dive in that once we actually break out into those breakout rooms to hear some more of that feedback from you and what change ideas could take place to make sure that it's identified inside of that AIM statement. So I just wanted to quickly reflect. I see Pauline taking those notes on the screen as well. We'll be able to further dissect this once we get into those breakout rooms, but I just wanted to share just how amazing this feedback is.
Thank you, Alexis. John.
I went with neutral on this one, and I just want to say that, I see a lot of talk about building the provider capacity, and I just don't know how relevant that is when, I don't know about anyone else, but we're not really seeing members come from the managed care plan. So we have a ton of capacity, and we continue to starve for members. And that's the sustainability problem there, right? So it's we've been through this phase. we're burning through our grant funds to get going, and the managed care plans have no, from what I can see, have no ability, you know, that, or maybe we're a low priority provider, but we are not getting relevant members in a timely manner, right? So like we're working with high utilizers that their qualifying events were in 2021. It's no longer relevant. So it's completely lacking in that aspect. And if they can't get that together in the next couple of months, we're going to close our doors.
That's real. Thank you. Yeah. All right. So I think people are ready to get into these breakout discussions. Let's go back to the slide deck. Thank you, Dakota. Appreciate you being here. Okay. So during these breakouts, we're going to focus on the driver diagrams that have been mentioned a couple of times, and also how we plan to measure what the metrics are. Okay. So breakout room A is going to be for the first AIM statement. This is for folks who are already contracted organizations and those who are working with contracted entities. Okay. Breakout room B is focusing on the second AIM statement. And this is for folks who are not yet contracting. Okay. Let's go to the next slide. All right. So the driver diagram is really a chart of the needs and then the ideas that are going to allow us to reach our goals. Okay, that's going to drive us to reach our goals. And we're sharing what we need in order to make our goal a reality. So again, the driver diagram we want to think of as a work plan or a roadmap. Okay. The measurement strategy is to determine how we'll measure progress so that we hold ourselves accountable and we track movement. We're all participating in this collaborative to see change and to make real difference. It's also what fuels our motivation and our hope. So we want to make sure that we're really able to track and hold ourselves accountable towards that. Okay. So unless there are any questions, we are going to move into the two breakout groups. Again, if you are currently contracting or working with the contractor, you're going to want to go to breakout room 1. If you are not currently contracting, you're going to want to go to breakout room 2. Welcome back to the big room. I think that's the coolest thing about Zoom is when everyone's faces pop up at once. I love that. I've probably said it before. It makes me happy every time.
The breakout rooms never feel like we have enough time. Oh my gosh.
Because it's a magical group of people who has the information we need. Yes.
Oh my gosh.
So let's do a really quick report out from each breakout room. I'm going to pass it to Teodros to facilitate this portion, and then afterwards close us out with next steps.
Great, thank you, Ashlyn. So even though we, obviously had an awesome conversation in our breakout room, I think we can start out with the room that Ashlyn facilitated. Do we have anyone who'd like to share back?
We ran out of time, so I'm wondering if I can nominate Michelle.
Well, I'm only going to remember what I said because.
Excellent. What you said matters. It doesn't have to be comprehensive.
Okay. Well, others from the room can certainly jump in and help out. But we talked a lot about, what would help a CBO or a provider understand if this is the right business for them. And not only that, understanding what the business need is, like who are the populations that are needing to be served, because you can get yourself all set up. But if you don't have the client flow to support the business need, that's not going to be helpful. So first half was talking about what would help some, an agency understand, like a business evaluation tool, perhaps, and then like a real kind of clear cut. This wasn't said, but this is my language. Sort of paint by numbers. Here's what, here's the contracting process. Here's how this works. Here are the steps in setting up your data sharing system, et cetera. And then the second part was talking about, really understanding the community needs for ECM services in Stanislaus and San Joaquin, and understanding what are the priority populations, making sure that those needs are being met. So that is my summary.
Great. Thank you, Michelle. And quickly for our breakout room, just 45 seconds, a minute or less. Do we have a volunteer? Hopefully I don't have to appoint one. Doesn't have to be exhaustive. Natasha, do you think you can take a stab at it? Just because I want to see your background one more time.
I feel like I keep getting selected for talking. I need to stop talking so much. You guys forget about me. No, I think that we did a good job of just summarizing the fact that, and Alexis said it so much better than I'm about to say it, but that there's definitely a need for the claims and streamlining and authorizations, but that there's also a need for more education to the community, to the public, et cetera, about what is CalAIM, what is ECM, what is community supports. And I know I'm missing stuff because I feel under pressure.
You're always under pressure, Natasha, because we appreciate you so much.
Great job. No, that's all. That's fine. And we only have a few minutes left too. And so I know there were a lot more great observations, suggestions, talking points that came up during those conversations. And we will be sure to make sure those are infused into the other notes and work that we're doing as a result of this. So if we go to the next slide, please. Okay, so we've got the third poll, and this is a really short one, and it's just asking, would you want to participate in an in-person meeting in the month of May? So please respond to that.
And just flagging for everyone that this is a poll by chat. If you all could just drop something into the chat first, that would be so amazing.
I was wondering why it hadn't popped up on my screen.
That was my fault.
I was just being left out, which that's fine too. Okay, great. Seems like everyone is willing to meet. Awesome. Maybe not Michelle, but what if we brought lunch? Would that change your mind?
A 6-hour drive for lunch, probably.
It's a really good lunch.
Yeah. No, I would do my best, but
no, it's okay. Let's so that's great. We've got that centered. Let's go on to the next slide. Okay, so next steps, folks. We're at the end of our meeting, which I know is probably making a lot of you very sad. Next month's session will focus on initiating the implementation of our collaborative work plan. So great, now we're moving from all talk to all action. Chronicling best practices and lessons learned, identifying progress, tracking towards goals. And some of the post-event action items include assessment. Make sure to please complete the survey included in the post-event email to determine what work planning efforts we will focus on during the April session. And also registration, please use the link in our follow-up email to register for the April session. Also, slides and supplemental materials will be provided via email. If folks have any questions, please contact Shiva at shiva@healthbegins.org for any questions pertaining to the collaborative. And in terms of supporting recruitment, please continue to spread the word with other potential CalAIM stakeholders by encouraging them to join us. So with that, I think we are at the end of our presentation. We have some slides and resources that folks can maybe see as we flip through them. If you want to catch us for some more talk, we will be on Jimmy Fallon tonight. Actually, no, it's going to be C-SPAN, and it's going to be at 3 a.m. So you won't be seeing us, I'm sure. But we thank everyone. Great session. Had a lot of fun, and spread the word. We'll see you next time.
Bye, everyone. Have a great week.
Thank you.
Bye, everyone.